Hello, my name is Atlee Shaw, and this is my X-Treme Makeover presentation for NU 713 Organizational and Systems Leadership for the Advanced Practice Nurse. Here's my table of contents for this presentation. The purpose of this presentation is to identify a time where miscommunication occurred in my work environment, discuss details regarding the event and how the miscommunication occurred, and discuss variables that influence the situation. I will also discuss conversation themes and what conversations say about an organization's culture, and discuss patterns of relating, patterns of meaning, ways of talking, listening, and being, and innovation. The miscommunication story will then be changed to show positive communication. The goal I have for my organization is to create a culture of healthy communication that promotes conversation as well as innovation and upholds the organization's mission and values. One busy afternoon while I was working on the pediatric unit, our pediatrician sent over a patient from the office to be a direct admit onto our unit. One of our newer pediatric nurses was the nurse who was going to be admitting and taking care of this patient. The patient was a 2-month-old who was not eating well and just not acting normal, according to the patient's mother. The nurse admitting the patient took the patient's blood pressure and it was lower than normal limits. The nurse retook the blood pressure several times to be sure it was accurate and continued getting the same reading. The nurse told the physician about the blood pressures. The physician knew she was new to pediatrics. Without consulting the nurse or any of the other experienced pediatric nurses on our unit, the physician walked over to the NICU and asked if one of them could come take the patient's blood pressure because she trusted their assessment and measurements more since they are more experienced. This was hurtful to not only the nurse taking care of the patient, but also to the other pediatric nurses on our unit who could have helped. How did the miscommunication occur? The miscommunication occurred between the physician and the nursing staff. During a high-stress situation at a busy work environment, because of the distrust between the physician and the nurse, the physician went behind the nurse's back into another department for help before even consulting the nurse taking care of the patient. The physician should have consulted the nurse taking care of the patient and asked her if a recheck could be done involving another nurse to be sure the readings were accurate. Because the physician went to the NICU, the nurse and whole department were embarrassed because they felt as though it looked like they didn't know how to care for the patient. This led to frustration among staff members, adding more stress to the already stressful situation. Failure by the physician to communicate concerns appropriately to staff led to frustration and tension between the interdisciplinary team. There were several variables that influenced the situation that led to miscommunication, including a high-stress work environment and stressful patient condition, miscommunication of concerns by the physician, and physician distrust in staff abilities. Trust among the interdisciplinary team is a vital aspect of good teamwork and communication. There are many different conversation themes among staff. One of the main conversation themes is how stressful situations tend to lead to quick and irrational decisions. This situation was not the first time an action like this by the physician took place. Stressful situations lead to miscommunication among the interdisciplinary team and can come across as there being a lack of respect, leading to increased stress and frustration among staff. An organization can be understood as a temporary stabilization of themes and habits that serve to organize the experience of being together. These conversations lead to a culture of frustration, feeling inadequate and incapable, feeling betrayed, loss of confidence, embarrassment, and lack of teamwork and communication. Interactions and conversations are what make up an organization. Innovation can occur when organizations are viewed as conversations rather than machines. Organization as conversation is formed by two main components: patterns of meaning and patterns of relating. Conversations and interactions like the one mentioned in the miscommunication story leads to an organizational culture of distrust, frustration, and lack of teamwork. Patterns of relating is how people interact with each other. This is what forms the culture of an organization. There are many different forms of communication. Communication at my organization happens face-to-face and over the phone. There is room for miscommunication with each form of communication. Communication over the phone leaves more room for miscommunication than face-to-face communication. Although in high-stress work environments and stressful patient circumstances, miscommunication is likely when the interdisciplinary team doesn't slow down and communicate effectively. In a continually changing environment, it is important to use communication that best fits the situation at that time. Patterns of meaning are specific themes that exist in an organization that make up the organization's culture. Mission and vision statements are examples of this. The mission statement at my organization is to provide a continuum of quality healthcare services within our resource capabilities, to serve as a leader in a collaborative effort with the community to provide health education, support services, and care for all of our citizens. The vision statement of my organization is, through the caring and dedication of our team of employees and physicians, Tanner Health System will be recognized as the provider of choice for quality, accessible health care for our patients and community. Good communication is essential for creating a positive culture at organizations. Miscommunication can break down the organization's mission and vision. The mission and vision statements of an organization serve as the organization's identity. Ways of talking, listening, and being all contribute to the organization as conversation. Ways of speaking can reinforce and stabilize the organization's culture. Good communication brings opportunity to uphold the organization's mission and values. It is so important to be intentional with our words and choose words that are positive and build up the organization. Our words become our patterns and habits. Our words and language serves to form and can transform our organization. Listening is just as important as speaking. It is important to listen to others, be attentive of the conversation, and pay full attention. It is also so important to be aware of our body language. Our body language speaks for us even when we don't speak actual words. Being aware of others' body language and gestures is an important aspect of listening as well. Another important aspect of organization as conversation is to be present and mindful. Being present moment to moment allows the ability to contribute to the organization as conversation. There are physical and emotional benefits of being present and mindful. For innovation to occur, a certain level of misunderstanding is needed. New patterns of relating and meaning can lead to misunderstanding. Misunderstanding leads to conversations. Misunderstanding and miscommunication can be used for good and for opportunity to spark conversation, leading to new ideas and innovation. Rewriting the narrative. One busy afternoon while I was working on the pediatric unit, our physician sent over a patient from the office to be a direct admit onto our unit. One of our newer pediatric nurses was the nurse who was going to be admitting and taking care of this patient. The patient was a 2-month-old who was not eating well and just not acting normal according to the patient's mother. The nurse admitting the patient took the patient's blood pressure and it was lower than normal limits. The nurse retook the blood pressure several times just to be sure it was accurate and continued getting the same reading. The nurse told the physician the blood pressures. The physician knew she was new to pediatrics. The physician told the nurse she trusted her skills, but that the blood pressure she was getting seemed a little off. She asked the nurse to take another nurse with her to go recheck the blood pressure and make sure it was accurate because she stated, "It never hurts to grab someone and double check." The nurse took an experienced pediatric nurse with her to go check the blood pressures again, and they got a more accurate reading. The physician was appreciative of the recheck and encouraging to the nurse that was new to pediatrics. The nurse was able to learn from the experience while feeling encouraged and supported. After rewriting the narrative, patterns of relating are open and honest communication amongst the interdisciplinary team, an environment that is encouraging, understanding, and patient, and an environment that displays healthy communication among the interdisciplinary team, leading to a positive work environment. After rewriting the narrative, patterns of meaning are that the organization's mission and values are upheld, An environment is created that is encouraging and uplifting. There is appreciation for the team and organization, and good communication and teamwork among the interdisciplinary team. After rewriting the narrative, ways of talking are things such as using words to be encouraging and uplifting to others, asking questions, and good communication. Ways of listening are displayed by being fully present. Active listening, having an open mind, and being understanding. Being/mindfulness is being fully present, engaging with others, being self-aware, and displaying good body language that displays an attitude of being present and in the moment. Here are my references for this presentation.